demonstration, I will be changing my continuous IV to an intermittent infusion lock, then doing an IV push and discontinuing my IV. So the first thing I'm going to do is look at my 6 rights. Right patient, right medication, right dose, right route, right time, right documentation. I'm going to do 2 identifiers on my patient, any allergies. And then I'm going to check for patency. There's no bleeding, swelling, or redness. So I am going to shut off my drip. And then unhook my IV. And then I have a piece of gauze under here for any drip so it doesn't irritate the skin. I'm going to clean the hub. And then I'm going to push five milliliters of normal saline, making sure that I don't have any swelling and that it goes easily. Okay. And then, so that is now saline locked. The next thing I'm going to do, I got a doctor's order to give Dilaudid 2 milligrams IV push every 2 hours as needed for a complaint of pain related to coughing. So the Dilaudid label states that 2 milligrams per milliliter, and then to dilute with 2 milliliters of normal saline for IV administration. I'm going to give 1 milligram every 2 minutes via IV push. So first thing I'm going to do is draw up, clean the top of my vial. Expiration date is okay, there's no floaties, no cracks. I'm going to draw up 2 milliliters of air. Draw up 2 milliliters of normal saline. And I put 1 milliliter of air in this. Draw up 1 milliliter, which has 2 milligrams of our medication. And since I will be putting a new needle on this, I'm going to one-hand technique, cap my needle, put on a new one, and then, or I wouldn't even have to put on a new one. And then I'm going to identify my patient using 2 identifiers, make sure I've checked my MAR 3 times when I took out the medication, when I drew up the medication, and now I'm going to check it again while I administer the medication. So I'm going to clean the lock. And you are to push Dilaudid 1 milligram every 2 minutes. So I'm going to push this over 4 minutes. So I clean my port, and remove the needle, put that in my sharps container. And then begin. So I would administer that over 4 minutes. See how they tolerated the medication. Make sure there's no redness, no swelling, no bleeding. Make sure the patient tolerated it okay. And then after I do my last dose of Clafuran, which was in my IV piggyback, which we did 4 doses of those, I'm going to remove my IV. So I'm going to come back in, wash my hands, ensure privacy, 2 patient checks, allergy checks, and then make sure that my MAR agrees that it's time to take out my IV. So I'm going to put on clean gloves, wash my hands, put on clean gloves. And then when I have gauze ready, just when I remove the catheter. And you want to be sure when doing this to hold the catheter tight and to peel everything to the middle. You want to be sure not to jerk out the catheter before you have all the tape, so hold it tight. And then apply pressure, pull out the catheter. And then before I would have flushed my medication, I would have done 5 milliliters to ensure patency. I would flush 5 milliliters normal saline. Then I would have done my medication, and then I would have flushed with 5 milliliters after before removing it.